From arthritis, back pain to weight loss, Connecticut Disc and Laser Therapy Centers believes in the use of therapeutic lasers for treating chronic conditions. Dr. James Dalfino is the president and director of Connecticut Disc and Laser Therapy Centers, as well as the author of Non-Surgical Solutions to Today's Chronic Conditions. Dr. Dalfino, welcome back. It's great to have you with us.
Thank you. Nice to be back.
All right, let's talk about your basic approach.
Okay, the practice basically focuses on the treatment of chronic conditions which essentially do not respond well to conventional treatment methods like chiropractic care, physical therapy, medications, and even surgery. So a lot of the conditions that we treat have focused on patients that have been lack of an alternative that's actually worked for them long term, and that typically is the approach that we take with working with the patients that are suffering from those types of debilitating conditions.
What type of debilitating conditions are we talking about?
Sure, things like neck and lower back pain. It's common for us to work with patients that have herniated discs, bulging discs, spinal stenosis, arthritis, even arthritis of the knee, even patients who have already had a knee replacement, shoulder injuries, even as much as fibromyalgia and weight loss.
Laser therapy, though, is a major focus of your treatment.
It certainly is, and the reason why is because the therapeutical laser has been around in the clinical setting for about 30 years now. But as time has come on, it's become more and more adept and more refined. And what research is showing now, over 5,000 documented studies on its effectiveness to actually heal tissue without the side effects of medications and without the needs for drugs or surgeries.
We're looking at video right here. Basically, what's it doing?
Well, what it does is it has the ability, this is the MLS laser, multi-lock system laser. It's a class 4 laser, and it has the ability, it's robotic, for us to actually map out and target specific conditions on patients that we want to work on. And the nice thing about it is that we can actually focus on a particular region of the body, like a shoulder, a knee, a lower back, and we actually plug in all the information into the laser's computer-generated system, which holds over 30 pathological conditions, and it actually knows what to treat, how long to treat, and when to treat. So it's all streamlined and systematic, and it gets patients extremely well.
We actually have the machine right here. Yep. And would like to bring in our intern, Julianne, to help us out to demonstrate this. And show us again how this works, Dr. Dalfino.
Well, if she could just place her hand right under the head there. What we're looking at there is just a little red X, and that's actually mapping out the condition. So depending on what area of the body we want to work on, if we want to work on arthritis of the knee, a lower back condition, herniated disc, something in the neck, or so forth, we actually focus all that into the computer system in the laser, and it actually gives us a marking so we can map that out on the actual patient. And then once we start the actual laser itself, it does it all seamlessly on its own.
So how does the laser really penetrate? How does that help the patient's condition?
Sure. What happens is, from a cellular level, when we shine laser light over an area of injured tissue, like a lower back, a knee, a shoulder, whatnot, the tissues absorb the laser light in such a way as to decrease inflammation, swelling, and pain. But secondly, and what I think is more important, it actually improves the circulation and healing to those areas by bringing more oxygen, nutrients, and water to areas to actually heal conditions.
So basically, patients aren't feeling anything really, maybe just a little warmth?
There might be a little sense of warmth, but with these type of lasers, they're actually considered to be cold, C-O-L-D, because there's no thermal value at all. So they're painless, there's no contraindications, no side effects, and no downtime.
Great. Julianne, thank you for your help. Yes, and what's been the reaction from patients?
Yeah, we've been working with lasers for about 10 years now in our clinic, and I have probably about 8 or 9 of them in the clinic at this point. And typically, most patients are going to see some sort of improvement or result, sometimes within the first 2 or 3 sessions. It's been really revolutionary.
And what's probably the most popular procedure or treatment do you use this for? Is it mostly arthritis?
A lot of arthritis, spinal stenosis, which is a type of arthritis, but typically our clinic sees a lot of patients with debilitating lower back pain, and we also see a lot of debilitating knee pain as well. So a lot of the focus of the practice has been on severe arthritis of the back or spine, as well as what we call the extremities, shoulders, legs, and knees.
This is really helping the body heal itself.
It does, and this is what the paradigm shift is with the conventional approach. Conventional approach is going to say, well, let's go ahead and try some physical rehab. We can put stress into the body, which can actually cause inflammation, and you feel worse when you left than when you first walked in. The second approach is medications, and although they're designed to actually help with pain and alleviating some inflammation, sometimes there's side effects. And that's what we want to try to avoid. So we're working with something that has no documented side effects, no pain, no downtime at all, and it's actually helping the body heal on its own. And you'll see not only lasers in clinics like mine, but even podiatrists are using lasers now for toenail fungus, and even veterinarians for animals.
Very good. And so if you want more information about Connecticut Disc and Laser Therapy, it's Connecticut Disc and Laser Therapy Centers located in Shelton. The number is 203-922-9277, or visit ctdisccenters.com. Dr. Dalfino, as always, thank you for being here.
Thank you, very good. And if anybody would like to get a free evaluation, they can certainly call the office, see if they may qualify or be a candidate for our care.
Very good.
Thank you.
You're welcome. All right, we'll have more of Connecticut Style right after this.